Now, parts of Melbourne are a ghost town because of this hard lockdown being imposed right across the metropolitan area. One tower block now still sealed off, those residents effectively trapped by public health orders imposed by the police. But likewise, there are checkpoints now around the vast suburban fringe of the Victorian capital, preventing people from leaving the city of Melbourne and going into the regions. And yet there are hard borders too, isolating Victoria from the rest of the country, hard borders across the New South Wales border and into South Australia. I don't like this at all. As you know, I never have. I think we need to isolate outbreaks, trace contacts, keep the virus under control, but preventing travel across state borders is, in health terms, imposing a completely arbitrary boundary. There's no outbreak in Mildura, for instance, and people can't travel from Melbourne to Mildura. So why can't Victorians in Mildura cross the river into New South Wales or scoot down the highway to Renmark in South Australia? There's every chance these state border closures that we've seen on and off now for months are unconstitutional. We await the challenge there. And there's no doubt they're inspired by state premiers rather than by a national approach to controlling the pandemic. Anyway, the trouble at the moment is that since late March, we've all laboured under the misapprehension that we didn't really have to worry too much about state borders because we'd closed off and quarantined our national border. That was our big advantage. It remains our big advantage. That was our virus-killing move. And the reason Melbourne, of course, is going through all this pain all over again is because the Andrews Labor government failed at that quarantine task. It stuffed up quarantine. While Daniel Andrews was telling lovers they couldn't even travel to each other's houses, he had security guards bonking people who were supposed to be in quarantine. It was that bad. And while Andrews was telling Victorians they couldn't play golf, apparently they had poorly trained security guards sharing cigarettes and God knows what else with people who were supposed to be in quarantine. Has there been a worse example of government incompetence in living memory? I don't know. Yet Andrews seems to be treated by kid gloves by many people in the media and in Melbourne. On Twitter today, there was a hashtag which said, "I stand with Dan." Seriously, not let's ban Dan or let's stack Dan, but I stand with Dan. That's how far out of touch with reality Twitter is. Can you imagine the outrage, the baying for blood, if a coalition premier had presided over this sad and costly debacle? 6 weeks. 6 more weeks in lockdown for Melburnians. Our Victorian friends, we feel for you, but I've got to say around the rest of the country, we worry that we'll face a similar fate now, whether it's either through more infections spreading out of Victoria or through government overreactions. After 3 new cases traced to Victoria, the people of the ACT have already seen a delay in the next stage of their restriction easing, and they don't even get to cast a vote on the Andrews government. Let's go straight down to Melbourne now and catch up with the Liberal MP for the federal seat of Higgins, Katie Allen. Thanks for waiting on that press conference for us, Katie. Tell us, bunkering down for another 6 weeks in Victoria, you'd have to be quietly confident this will work, but at what cost to the community?
Absolutely, Chris, thank you. Look, the mood down here is very sombre. People know, we know how to get control, hopefully, but at what cost? And you're absolutely right. But I think, you know, the most important thing is that this is a different outbreak than previously. And so these containment measures that have been put in place are absolutely essential. And it's about containing the problem so that Australia doesn't have the problem. We keep it contained here in Melbourne. And so the success that we can bring to this will be a success for Australia. So I think every Australian is pretty glued to the numbers in Melbourne. There's
got to be political accountability. I think we all have to focus, media, public, politicians. Of course, everyone's got to focus on getting on top of the problem. But we can walk and chew gum at the same time. Do you believe that Daniel Andrews is facing appropriate accountability measures over how the Victorian government allowed this virus to escape quarantine?
No, quite frankly, I don't think he is. I think he's kicking the can down the road with his judicial inquiry. With the federal government, we had a Senate committee that was chaired by Senator Katie Gallagher, who has provided an opportunity for questions to be asked. And I think when the Ruby Princess event happened, Gladys called for a Royal Commission, and we were able to get some answers that helped us to understand what went wrong. Now, this is not about finger pointing. This is not about heads must roll right at this moment. In fact, we need the Premier and the entire Labor government focused on delivering the outcome for Victoria so that we can deliver for Australia. But this is about making sure we know what went wrong with quarantine, because we have passed the buck to other states to do our quarantining for us, but we want to make sure that any mistakes we've made are not repeated by the other states and territories, because that is the most important defence. As you said in your introductory remarks, our international borders and our quarantining, our tracing and tracking and our physical distancing, those have been the four pillars of making sure that we're keeping all Australians safe. And it looks like, even though we've known what we should do, that hasn't been done here in Victoria, and now we're cleaning up the mess afterwards.
Yeah, I think in the interests of everyone in this country, we need to know exactly what went on as soon as possible, as you say, so we don't repeat those mistakes. I should point out for our viewers that you are a medical doctor as well. When you talk about those measures we've put in place and the physical distancing, a big change in the attitude coming from the official sources now, the Chief Medical Officer and the Victorian Chief Medical Officer, saying that masks are recommended now. If people are going out into public transport, if they're worried about public distancing, go ahead and wear a mask. Do you think that's wise? And why has it taken us so long to get to this state, given other countries have been recommending it a lot earlier?
Yeah, thank you, Chris. Look, I am actually a public health expert, and so I'm a medical doctor who cares for, have cared for individuals, but also looked at the system. And to this point in time, I have not been supportive of masks, because you need to know how to use them and to use them properly. And it's not necessary when there's a low prevalence. But now in Melbourne, we have a very different problem. In the past, the rising numbers have happened in a quarantined or self-isolating population. So we've known that there's only been a 10% community transmission. Most of the people who have had COVID have been safe at home or in quarantine. We now have a reverse situation here in Melbourne, where there is a very high rate of community transmission. That means that there are people out in the community who may not know that they have COVID. So I would now support the new measures, because in Melbourne we have a higher prevalence. We have a situation where we have a new resurgence which is of a different nature. This is not about Australians returning home from overseas knowing they've got COVID, being in quarantine and being safe. This is about a community transmission situation. And so until we get this back under control, if you have to be out in the community and you cannot physically distance 1.5 metres, then it is recommended that you use a mask. And we know that in the past, masks have been recommended to prevent people who've got symptoms from spreading to other people, but we're now recommending an extra layer of precaution. Of course, physical distancing, 1.5 metres, remains very important. Hand hygiene remains very important. This is just an extra layer as we're dealing with a very different scenario here with a community transmission-led pandemic here in Melbourne.
Very early in this pandemic, I spoke to an expert in Hong Kong. Of course, they have had experience with the pandemics before. And he mentioned that the mask, apart from the physical attributes that the mask might bring to the task, it acts as a psychological reminder to people wearing it about those other physical distancing measures. So he said that's another reason it was very important. Just finally, Katie, if I could ask you, given that Victorians are going into lockdown again for 6 weeks, you won't be too happy about that. But what has the community learned from the first period of lockdown that's going to make them either resist this lockdown or do it better?
Look, there's been a lot of discussion about Melburnians or Victorians resisting lockdown, and I think we need to look at the leadership with regards to messaging. It needs to be very consistent. We don't want to have inconsistency about, 1 week you can't meet 10 people for a funeral, the next week you can meet in large gatherings and only the organisers, 10,000 people and only the organisers get fined. So we need to be consistent with our messaging. I think what we've learnt is that consistency of messaging is very, very helpful. The federal government has invested $30 million into culturally and linguistically diverse communities, but we do know word of mouth is so incredibly powerful. People know that there is a COVID pandemic. You have to be blind Freddy not to know that, because people can't participate in their normal daily activities, whether it's with their family or if they have a faith-based approach with going to their local church or temple or mosque. So people know that there's something going on, even if they haven't got English as a first language. But we need to make sure that we provide the details and communicate properly across the whole community in a very consistent way about what you can and can't do. And we've also got to make sure we have the trust of the community by being transparent about what the numbers are, what they mean, and what we've done wrong, and what we can learn from it. So understanding what went wrong in quarantine is incredibly important, because that will help us understand what to do going forward.